Bonsoir. Thank you. I come from England. Like most people from England, I speak French very poorly. So I will say bonsoir, merci beaucoup to Nestlé Purina for the opportunity to speak here. And I won't torture you anymore with my outrageous attempts to speak French. So I've been asked to try and give something of a practical overview of lower urinary tract disease in cats and how we as clinicians try to approach diagnosis and management of these cases. So, that's interesting. Let's see if we can. Okay. So what I wanted to show you first of all is just a study that was presented at the British Small Animal Veterinary Association Congress 2 years ago. This was a study that just looked at just over 300 practices in the UK, and it looked at how they managed lower urinary tract disease in cats. And I don't know how well this reflects your own experience and what you do, but this was over 300 practices. On average, these practices were seeing around 5 cases of lower urinary tract disease in cats every month. And when these cats were presented for the first time, for the very first time, with signs of lower urinary tract disease, in nearly 50% of cases, they were given symptomatic treatment only. And there's nothing wrong with that, and I wouldn't argue with simply treating a cat at first presentation symptomatically. There were almost half of them, in fact, that had urinalysis done, and I think that's a very good starting point as well. If we're going to investigate a cat with lower urinary tract disease, then performing urinalysis is a good thing to do. But when you look at the symptomatic treatment that was given to these cats, around about 3/4 of them had non-steroidals. Again, that's a good idea. This is a painful disease, so providing them with analgesia is a good idea. We'll talk more about diet change and management change for these cats. These are good ideas as well, but nearly 70% of them received antibiotics. And we have to ask ourselves whether it's really justifiable on a symptomatic basis to treat cats with antibiotics with lower urinary tract disease. When these cats were presenting with recurrent episodes of lower urinary tract disease, then the picture was a little bit more different. When cats were presented with recurrent episodes, most of them had some sort of investigation done. And again, quite appropriately, the vast majority of these at least had urinalysis done before they went on to symptomatic therapy. And in around 72% of cases, that included a urine culture. But even with the benefit of doing urinalysis and urine culture, still nearly 80% of these were treated with antibiotics. I'm not going to ask you how frequently you treat cats that present with lower urinary tract disease with antibiotics. But of course, what we know from epidemiological studies that have been done is that bacterial urinary tract infections are uncommon in cats. They are not a common cause of clinical signs. This is a pie chart that represents 2 studies that were published in the United States, almost 200 cats that presented with non-obstructed lower urinary tract disease. Urinary tract infections represented only 2% of those cases. Even in more recent studies, typically urinary tract infections only represent up to 5 or 6% of cases of lower urinary tract disease. So UTIs are uncommon, and clearly symptomatic therapy with antibiotics is unjustified. In these studies, the majority of cats were diagnosed with idiopathic cystitis. Just over 20% of them diagnosed with urolithiasis, some with anatomical abnormalities, urethral strictures, etc. Some ultimately diagnosed with behavioral problems and so on. But it gives us an idea of the spectrum of disease that we're dealing with. And there are other studies that have been done which show a very similar spectrum of disease. So this is perhaps a typical clinical case. This is a cat called Ben. Ben is a large cat. You can't see Ben very well. This is not a particularly good picture of Ben. I should tell you that this is not a normal size cat litter tray. This is an industrial size cat litter tray. To give you an idea of how big Ben is an overweight cat. He is a cat that in fact weighs 13.5 kilos. He's a big cat. He needs a diet. He's a 5-year-old cat. He's an indoor-only cat. He is obese. He's fed on dry cat food, and he lives a very sedentary lifestyle. He doesn't do very much with his 13.5 kilos. He has all the typical risk factors for lower urinary tract disease. We know that he's a high-risk cat for lower urinary tract disease. We were actually treating him for lymphoma. He'd been treated, he was in complete remission, we'd been treating him for about 6 months, and then he developed recurrent signs of lower urinary tract disease. And the question is, a cat like Ben, what do we do with him? Do we play the numbers game? Do we assume that it's going to be a case of idiopathic cystitis because we know that something like 2/3, 3/4 of these cats are going to have idiopathic cystitis? Or do we investigate and find out what's going on? And actually, in the vast majority of cases, working out what's going on in a cat that presents with signs of lower urinary tract disease is really straightforward. If we do urinalysis, ideally if we collect a cystocentesis urine sample, if we do simple urinalysis, sediment analysis, bacterial culture, and if we do diagnostic imaging, then we can work through that list of major differential diagnoses. We may be able to identify a specific underlying cause, and if we don't, we stand a good chance, at least by exclusion, of making a diagnosis of idiopathic cystitis. So when it comes to unraveling lower urinary tract disease, a clinical approach to lower urinary tract disease, I think most of these cases are straightforward. We need a good history and clinical examination. That tells us a lot about what might be going on. We need good urinalysis, and we need to be careful about how we interpret that urinalysis. We need to do diagnostic imaging. And if we do those things, then most cases we can make a diagnosis and we can treat appropriately based on those findings. Now, I don't want to spend a lot of time talking about doing history and physical exam. These are things that we're doing all of the time, but there are important questions to ask in a cat that presents with lower urinary tract disease. Is it the first time, or is it recurrent disease? How severe is it? What's been the duration of the episode? What are the clinical signs that the cat presents with? What diet has it been fed? What sort of lifestyle does it have? Are there any factors that are obvious in the environment that may be causing stress? When the cat urinates, is it able to empty the bladder, or is it straining to urinate, and does it still have a full or partially full bladder? These are all things that are quite useful to try and obtain on history and physical examination. So we said most of the time we will try and get a cystocentesis urine sample from these cats, usually very easy to obtain. Routine urinalysis, dipstick analysis maybe, but we're going to get a lot of information from urine sediment analysis and urine culture. But we need to be careful with our interpretation. We've already said bacterial cystitis is a relatively uncommon cause of lower urinary tract disease in cats. More common in certain populations of cats. Certainly if we've got a cat that's been catheterized for any length of time, we've interfered with normal defense mechanisms. If it's had a perineal urethrostomy, again, we've interfered with the normal anatomy. Older cats, cats with concurrent kidney disease, with hypothyroidism, with diabetes mellitus, these are cats that we know have a higher risk for bacterial cystitis. But it remains a relatively uncommon disease. Oftentimes we may be able to diagnose it simply on urine sediment analysis, but certainly with the backup of urine culture as well and sensitivity testing. One of the other things that we need to be careful of with urine sediment analysis is how we interpret crystalluria. We've talked already a lot this evening about supersaturation of the urine and the fact that normal cats do produce supersaturated urine quite a lot of the time. It is perfectly normal for healthy cats to produce crystalluria. This is a graph derived from a study that was published a few years ago from University of Bristol, where they looked at a group of perfectly healthy cats that were being fed a mixture of dry and tinned cat food. And even in fresh urine samples from those cats, around about a quarter of them, 25% of them, in fresh urine samples that were spun down immediately, had crystalluria. Crystalluria is perfectly normal in healthy cats. Actually, a lot of the time, though, we'll collect a urine sample and we'll leave it sitting on a bench for a few hours, or we may send it off to an external laboratory and look at the results from an external laboratory. If you leave it for any length of time sitting in the environment at room temperature, you get a lot of in vitro crystallization as well. The urine cools down and you get in vitro crystallization occurring. So a lot of the time what we see as crystals in the urine actually weren't even there when the urine was in the body, in the bladder. It's only when it's cooled down, when it's come out of the body. So depending on how we assess our urine, how we're looking at urine samples, crystalluria can be a perfectly normal finding in up to 75% of cats. So we don't want to get too worried about crystalluria per se as a finding, but there are times